Belts on buses would save lives.
In health news now, and a landmark study on blood pressure could change guidelines for all patients. As Erica Edwards reports on the findings, that's especially good news for adults over 50.
When it comes to treating high blood pressure, heart doctors keep one question in mind.
How low can you get? How low is too low?
Yeah.
Dr. Jackson Wright of UH Case Medical Center in Cleveland is one of the main investigators in a clinical trial that appears to give some answers. More than 9,000 people with hypertension and one other heart disease risk factor were assigned to target either the usual 140 blood pressure reading or much lower, down to at least 120. Just 3 years into the planned 5-year study, the benefits of more intensive treatment were clear. Fewer heart problems and a reduction in heart-related deaths.
Regardless of whether the patients had cardiovascular disease or not, had kidney disease or not, were black or white, male or female, or above or below age 75, all appeared to benefit similarly.
The study did not include and does not apply to people with diabetes, anyone who's had a stroke, and those under age 50. Some outside experts call the results a potential game changer.
I'm thinking about patients over 50 who have real risk for heart attack or stroke, but aren't frail. They're robust enough to tolerate a lower blood pressure where we can see the benefit.
There were troubling side effects with the more aggressive treatment, a slight increase in fainting and kidney damage.
We don't want to ignore these results, but we want to understand these results better before we change practice across the country.
Researchers are still trying to figure out if the lower blood pressure had an effect on memory. Those results won't be ready until next year. In Orlando, Erica Edwards, NBC News.
Coming up in sports, we're talking UH's next head coach.